Thank you for joining the AMR Narrative YouTube channel, dedicated to empowering patients and the public with knowledge around antimicrobial resistance, or AMR. In today's episode, I talked to Tori Kinamon, an inspiring AMR patient survivor who overcame a fatal MRSA bacterial-resistant infection caused by an athletic injury when she was a successful gymnast. Following that, she pursued a career as an orthopaedic surgeon to help other patients with athletic injuries and infections. And today she also advocates on a larger scale by sharing her story. So let's take a listen to Tori's interview. Hi, Tori, and thank you so much for joining us today on this YouTube interview. It's such an amazing pleasure to have you as a fellow patient advocate. I think before we get started with the interview, could you tell us exactly more about who you are and your patient journey that you had in terms of AMR?
Of course. Well, thank you so much for having me. It's an honor to have a platform such as this to share my story. So my name is Tori Kinamon, and I am an AMR survivor and now patient advocate. So my first confrontation with antimicrobial resistance was when I was a freshman in college. I was doing Division I collegiate gymnastics at the time at Brown University in Providence, Rhode Island, and having a really great season. About a week after a major championship competition, I had the gradual onset of pain in my left hamstring. And I didn't think much of it. As a gymnast, you're always working through aches and pains. But within a week's time, the pain increased exponentially. And, I saw my athletic trainer about this pain. He thought it was maybe a muscle strain or some knots in my hamstring. We got a number of x-rays to see if I had an avulsion fracture, which is where the muscle pulls off the pelvis, and really just had this kind of unexplained pain. Eventually, I developed fevers, chills, night sweats, and started to feel systemically ill. So I sought further evaluation at the hospital, and they thought that I had cellulitis, which was a skin and soft tissue infection of my left posterior thigh. They put me on broad spectrum antibiotics. However, I continued to get worse even when I was in the hospital. So they involved the general surgery trauma team, who took a series of imaging studies that showed that I actually had an 18-centimeter abscess that was beneath my hamstring muscle and an associated associated infection in that muscle. So I was taken in for emergency surgery. And at first they made a 2-inch incision on the back of my leg, trying to gain source control. And eventually they had to completely fillet open the back of my leg because the infection just kept spreading up and down my leg. So overall, I had 8 surgeries in 2 weeks to debride the infection that was in my leg. And, after culturing the debris in my muscle, they discovered that it was a methicillin-resistant Staph aureus infection, or MRSA. Which is very dangerous and resistant sort of infection. So again, I had those 8 surgeries in 2 weeks. I was in the hospital for over a month, spent about 5 days in the ICU because my infection progressed into septic shock. And then once I was finally discharged from the hospital, I spent the next 5 months in intensive physical therapy, learning how to regain use of my leg.
Yeah, it's like really harrowing when you find out that you have a resistant infection. Being a patient also going through that was really frightening. You mentioned that you found out it was MRSA. I mean, how did you know that? How did you find out that it was an antibiotic resistant infection?
Yeah, I remember being in the hospital and being quite ill for the first part of my hospital stay because I was so sick. I was mostly sleeping. I was a bit delirious because of how sick I was, and then I was on a lot of pain medications. And when I finally started being a little bit more alert, as I finally started gaining source control of the infection, um, I remember asking a lot of questions and hearing them say MRSA. And, in my mind, I had heard of MRSA before because it is a type of infection that can be acquired from athletic settings. You think of people who are at risk for MRSA, and that's athletes, military personnel, people who are in close spaces and sharing objects. But you usually only think about it in wrestlers or football players in those high contact sports. And I remember being very shocked that I had that sort of infection because, one, I considered myself a very hygienic person, as a 19-year-old female at the time. So there was that element of it, how did I get this infection? And then the second and more harrowing part of it was that it was resistant to the very common antibiotics that we use to treat infections. And so I quickly realized that, oh my goodness, surgical source control is one part of this issue, but having antibiotics in the stockpile to treat my infection is another. And I remember feeling very frightened at that prospect that, what if we don't have a medication that can treat this infection? And, what do we do if we don't have enough options? And that left me feeling very hopeless and isolated, honestly. And then, when you have an antimicrobial resistant infection, you're on all the contact precautions. You have a limited number of visitors. Doctors come in all this gear, and that also feels very frightening. You feel like there's a lot of stigma. And, I just remember mentally and emotionally, it was a very, very challenging to hear that I had a drug resistant infection.
Yeah, it is. As you say, the stigma, yeah, I relate to that completely. Just being full of infection and, for me, it was on my face and just not knowing how on earth it was going to go away and people asking
Right.
questions. And um, in the past, you've talked about delayed diagnostics being a major factor in your journey. How do you think that impacted you?
I think when you think about antimicrobial resistance, I think another important part of that story is also thinking about sepsis, because these infections, when they're not treated promptly, your body can mount a massive immune response, leading to sepsis and septic shock. And so that's where I think, the delay in diagnosis was key for me is, one, recognizing the early signs of infection, and two, also recognizing the early signs of sepsis. And I've heard about this in other survivors, such as myself, i.e., people who were young, healthy members of the community with no comorbidities, no other medical problems. When I went to my athletic trainer and I had a painful leg, they thought it was, probably a sports injury. After that, I went to student health because I had this painful leg, and then I started to develop the fevers, chills, night sweats. And they said, oh, you probably have the flu, go back to your dorm. Nobody put together that the painful leg and these symptoms of systemic illness were connected. And, as a patient at that time, I just trusted what my doctors, what my healthcare practitioners told me, and I didn't think to connect the dots myself. And, so that led to roughly a week of misdiagnosis, roughly a week of attributing these vague symptoms to other conditions that weren't related, when in all actuality, I think that allowed my infection to become more severe. It allowed my infection to become deeper rooted within my muscle and spread to my bloodstream. And so I was very lucky that, I basically went to the hospital where they started treating with those broad spectrum antibiotics, because as a college student, I don't think I would have taken the next step to kind of escalate the level of care that I needed after multiple doctors had told me that, it was a muscle strain or just the flu, not connected. And so when I think about delayed diagnostics, I actually think a lot about, what can we do to educate patients? What are the signs and symptoms of an infection? You know your body better than anybody else. So if you have pain out of proportion to the injury, if something isn't just adding up, we need to empower patients to vocalize that for themselves, because unfortunately, you are your best advocate. As a medical community, I think that we can do much better educating patients about what to look for, and again, empowering them to ask questions.
Yeah, that is so important. And as a patient advocate, I talk about exactly the same. We listen. We have to listen to our doctors, but we
Mhm.
also need to be able to use our voices to ask questions when we feel something is wrong.
Yes.
So that is so key. So in terms of diagnostics, I mean, what do you think we can do better?
Hmm. Yeah, actually, this kind of bleeds into infection prevention and control for me, because this MRSA infection that I acquired, I picked it up from the athletic setting, and so I think that um, with MRSA, maybe 2 to 5% of the population is actually colonized with MRSA, and they don't have any signs or symptoms of that infection. So if you think about high risk spaces like the athletic setting, like military facilities, like schools or daycares where there's a lot of like shared material, I think sampling the environment and seeing, what sorts of bugs are here, and if there are, what sorts of, sanitation, hygiene, and wash strategies can we put in place to change the risk environment that these infections actually arise from, because multi-drug resistant infections are much easier to prevent than they are to treat. So, I think, looking at the environmental risk factors that are there is something that's very important. In terms of a diagnostic tests, in the healthcare setting, I think my mind goes towards, recognizing the early signs and symptoms of sepsis is very important for escalating the level of care that people need. Because unfortunately, some culture data, it can take 2-3 days to return. And so you don't necessarily know what you're treating when you start people on broad spectrum antibiotics. And I'd like to see improvements in that, but I think a more realistic thing is, one, changing the environment first, and then two, recognizing signs of sepsis early.
Yeah. I've come across that quite a lot, when you say that 2 to 3 days to get back the test results. And I had exactly the same, where, but when I did get my test results, I finally, the light bulb went on. It was like, okay, this is what it is. What do I need to do to be an equal stakeholder in the fight to make sure that I can improve managing
Right,
this infection?
right.
So, I mean, you're currently a leading patient advocate for AMR, even seeking out a medical career to understand orthopedic infections better. Is there anything you wish you had known back then, which you know now?
Hmm. Yeah, so I'm about to begin a residency in orthopedic surgery after having gone through 4 years of medical school. And, honestly, a lot of the motivation for me to go to medical school was thinking about what happened to me as a patient, how I was treated, and how I wanted other people to be treated when they were in that position. I recognize I acquired this infection that could have been prevented, or it could have been treated earlier to prevent how serious it became. And so knowing that there were action points that I could intervene on as a doctor really inspired me to take the journey through medical school and, pursue a residency in orthopedic surgery. And so, when I think about, as a doctor, what I hope the patient who's experiencing their illness, their sickness in that hospital bed, what I hope they know is, again, they know their body better than anybody else. And so I want to empower them to be able to speak up if things aren't making sense. I want them to be able to ask me or the rest of their healthcare team questions about the infection. How did they acquire it? What is causing it? What are the steps to treatment? So I think that patient-doctor relationship, that communication, is key. Unfortunately, there's a lot of like hierarchy in medicine, and I think sometimes we don't necessarily create the most comforting and welcoming environment for a patient to be able to ask those questions. But I think that creating that space where you can have good communication between patient and doctor ultimately benefits patient care at large. And I think too, as a patient, again, when I was a 19-year-old female, I didn't think that antimicrobial resistance was something that I had to worry about. I thought that it mostly affected patients who were in prolonged hospital stays or people who were immunocompromised. But something I realize now is that antimicrobial resistance, it can be a threat to anybody in our communities, in our states, nations, globally. Some populations, of course, are affected more so than others because of risk factors in their environment or within their medical comorbidities at large. But antimicrobial resistance is something that we all need to be concerned about. And when you're thinking about things like infection and public health, we're all intertwined. It's all a burden that we need to bear together.
Yeah, definitely. And you know what, like you kind of giving me goosebumps because because as when I got osteomyelitis, I got the infection in my facial bone. It was very key for me to work with my maxillofacial surgeon at that time. To kind of say, well, now this is really a little bit worse than it was before. So I was taught having that conversations. I was taught to really adhere to my antibiotics properly, practice RPC properly, down to the level where I was literally sterilizing everything at home, sterilizing things even in the hospital, you know.
Mhm.
And I think as patients, even asking some of the nurses and so on, have you washed your hands before you work on me?
Yeah.
So that just came with a little bit of experience and a little bit of time, but we don't need to go through an experience to teach people this, I feel, you know.
Absolutely. Absolutely. And I actually highly relate with that because, after I had my infection as a freshman, I ended up being able to return to collegiate gymnastics and compete. And I remember being in the athletic training room and wiping down all the equipment before I got on it. Again, trying to minimize the risks in the environment. And people would ask me, why are you wiping that down? Or, oh, are you going to wipe everything down? And I said, Yes, I am, because, I saw that something like this can happen to me. I don't want it to happen again. I don't want it to happen to other people, especially, as you said, when you see very small points that you can intervene upon to reduce the risk, because it's just not worth it.
Yeah, exactly, exactly. And it makes a huge difference. It made a huge difference in my journey as well. So I
Mhm.
guess our last question would be, I mean, what led you to become a patient advocate? I mean, you've talked a bit about this already. And have you got any advice for others seeking to also raise their voice for AMR?
Mhm. What led me to become a patient advocate? There was one moment in the hospital that really stood out to me. Again, I was a freshman in college. All of my friends were on spring break at the time, and I remember it was the first time that physical therapy had cleared me to stand up from the hospital bed. So, I had just had my eighth surgery. I had a wound vac. I had all these IV pulls, and I was able to crutch with my mom to a hospital window, and I could see my college campus across the highway. And I remember thinking, that's where I should be. How did I get here? How did this happen to me? I feel like I'm a victim of this infection. It completely overtook my life. And I remember something in that moment. I said, this is not the end of my story. This is the start. I'm going to make it my mission to reframe this traumatic experience of mine into something that can benefit other people. And I did that by getting into research. So I did a lot of research on, infection prevention and control, the epidemiology of Staph aureus and other drug-resistant infections. Ultimately, that led to more research in antibiotic development and even working with the US Food and Drug Administration, thinking about endpoints for clinical trials as we're trying to approve more antibiotics in the stockpile. Um, and so, that commitment to trying to make meaning of my suffering to benefit other people, it gave me a lot of closure, honestly, from my experience. And then, researching these things intellectually, it also gave me closure as well. And so, I think just being so motivated by how challenging of an experience that was, led me into patient advocacy. And I will say, the more patient advocacy groups I'm a part of, the more I share my story, the more I realize, you know, the unity that comes in sharing your vulnerabilities. There were certainly times before I shared my story where I felt very alone, very isolated. It was definitely very emotionally and mentally challenging for me to have gone through that and feel like nobody else understood what I was going through. Nobody else understood what it was like as a 19-year-old who was, going to sleep for a surgery, not knowing if they were going to have to amputate my leg or not. Nobody knew what it was like to be so afraid that I would acquire one of these infections again, or that I didn't know if it would happen to me again. And you find these patient groups and you can just connect over all those things. And I think it's very validating. Again, there's just a lot of unity in it. And there's a lot of power. I feel very empowered by being a patient advocate. And so for somebody who's wondering, should I share my story? Should I not? If emotionally and mentally it's in your capacity to do so, I would really encourage that. It's been, that infection happened to me now 10 years ago, and it's been an incredible healing journey. The more I've immersed myself in patient advocacy, the more complete and whole, that part of my story feels. And it's just such an honor and such a privilege to hope that me sharing my story empowers somebody else to do the same.
Yeah, I mean, you've been amazing with your sharing your story, and even for patient advocates like me that have been working for a long time, I love looking at your story. I learned so
Uh,
much, and I think that any other individual, for me, when I went from the hospital bed and I got onto online and I started advocating, I thought, wow, it's a really scary first step to take. So it's important to hear, the experiences like yourself, somebody as inspiring as yourself. So thank you so much for sharing it all with us. And yeah, thank you very much.
well, of course, thank you so much for having me. Really a pleasure.